A 28-year-old male undergoing elective surgery under general anesthesia. 10 minutes after induction, anesthesiology notices that sudden rise in the end tidal CO2. Second, he was getting tachycardia. Third, he was getting a generalized muscle rigidity. And fourth, and he was sweating profusely, and the temperature was more than 40 degrees Celsius. So the assistant asked the anesthesiologist, "Sir, it is sepsis." The anesthesiologist replied, "No, it is a hypermetabolic state, which is known as the malignant hyperthermia. It is the hypermetabolic muscle crisis, which is triggered by the anesthetic agents. The most commonly anesthetic agents involved in it is the succinylcholine and the volatile inhalational anesthetic drugs such as levoflurane, desflurane, isoflurane, sevoflurane, etc. So, what is the pathophysiology behind it? First is the genetic predisposition. There is a mutation in the RYR1 gene, which causes this muscular triggered activity in the receptor of the calcium channels in the muscles. Second is the volatile agents. For example, the trigger agents, as I told, the succinylcholine and the volatile inertial anesthetic agents. The third is there is a profuse release of the calcium from the sarcoplasmic reticulum in the muscles. So due to this, there is a generalized muscle rigidity, and in the compensation of it, the muscle tries to push back the calcium into the sarcoplasmic reticulum, but in the expense of ATP. So there is a loss of ATP, and it is the hypermetabolic state. So body start burning, and there is a rise in the temperature. When it comes to the treatment and the management part of the malignant hypothermia, the first is to stop the triggering agent. The second, give the 100% intranasal oxygen. Third, the life-saving drug for this, the IV trantolene. It is the drug of choice for the malignant hypothermia. Also, send the ABG for to see the metabolic any cause of the metabolic acidosis, and also see the potassium serum potassium level, because it can trigger the arrhythmias in the heart. Though it is a very rare, but it is a very lethal condition. So, before going any elective surgery, please give a proper history to your anesthetist, because this is the genetic predisposition factor. So if there is any also if any family history for this condition, please give to your anesthetist so that it can be prevented and the life can be safe. As we know that early recognition and acting fast in all these conditions can save someone's life. Thank you. Have a good day.